Good evening and welcome to yet another episode of the Health and Wellness Show. My name is Chabet Birir and this is where we inform you, we empower you and inspire you to take full control of your health and live your best life. We are still saying Happy New Year until March, so I hope your New Year is coming along well. If not, stay hopeful. Now today we are talking about HIV/AIDS and its relation to TB and cancer as well as COVID-19. And with me on set, I have one amazing lady who is a health advocate. Her name is Emily Mukomunene. Karibu sana Emily to the show. And I'll let you introduce yourself further. While you introduce yourself, please tell us what inspired you to be a health advocate, specifically for HIV and cancer. She's written several books, but these two are just some of them. One is called The Struggle of TB, HIV and AIDS and Coronavirus or COVID-19. And this one is Handy Tips on Cancer. Yeah. So we'll talk about these books, but let her introduce herself first. Karibu sana.
Asante sana Chebet. Happy New Year.
Happy New Year.
To all our viewers. I'm Emily Mukomunene. She has introduced me, and I'm a health advocate. I'm a health champion, and my interest in the health sector is, I think, mine is passion-driven, because I hate to see people suffering. Okay. Either poverty-driven suffering or disease-driven suffering. And then at one time, I had a personal encounter with friends who were misdiagnosed with particular diseases and mistook maybe you are diagnosed with TB, but now you are scared you think you're HIV positive. So I dived into doing research to find out that what's the relationship between TB and HIV, so that I could be able to empower them and set their minds at peace. At one time, I was also misdiagnosed with cancer of the esophagus, and I was lucky because when I was just looking for funds for treatment is when I discovered it was actually not cancer. It was something had compromised my immunity, and that's why I was experiencing the same symptoms that when I went for checkup, and after a few referrals, they were concluding that I had cancer of the esophagus. So mine is to give knowledge to the people so that we can be able to make informed choices about the decisions we make about our health and also the steps on preventive measures. Yeah, so knowledge is there, and we must get it so that you are not treated for what you are not suffering from, and if you're on treatment, to ensure that the treatment you are getting is working treatment. Yeah,
for sure. Indeed, knowledge is power. When you're knowledgeable, then you're able to know your treatment options and decisions that you can make after diagnosis, or when you have signs that you suspect, then you're able to make the right decisions.
Informed choices.
Informed choices
in life.
Yes.
And we also say knowledge is power, or it's a weapon if used properly.
Yes.
You might have the knowledge, but if you don't use it, then it will not empower you, and it will not also protect you. So what we know, we must use it to protect ourselves.
And I like that you are also a Pan-Africanist who believes that more can and should be done to eradicate disease and poverty in Africa.
Yes.
It's a very interesting stand to take, and I think we'll talk about that also in relation to HIV. But first, let us talk about HIV and AIDS. It has really evolved over time since the first time it was diagnosed in Kenya, that is in 1985.
Yes.
Were you here?
Yeah, I was here. I was here. You know, I'm a person of many generations.
How old are you? I'm a women, don't say the age.
I can say I'm 57.
You're
I was
57?
born in 1968.
Wow.
Yeah, I don't hide my age.
Me neither.
Yes.
Yeah. So you were here when the first case of HIV was diagnosed in Kenya.
I am telling you.
Do you remember?
Yes, I remember, because I was I think I was just in my early secondary school life.
And 20s or teenage? You were a teenager.
I was a teenager.
You were a teenager.
I was a teenager at that time.
Okay.
So and I remember there was a teacher. One of our teachers, she was our friend, and she was expecting that time. And all of a sudden, somebody who was very jovial, even in the classroom, and relationship with their pupils, she was very scared. Then we asked her, "Madam, what's wrong with you?" And she said, "You know, there's a new disease, and we hear now even the baby I'm carrying may not live, or may live deformed." and we don't know whether I'll also be able to give birth successfully or even feed my baby. Because there is no cure for this disease.
Had she been diagnosed, or she was just talking out of fear?
She was talking out of fear because what was there at that time, it was a lot of fear. Because first of all, when the initial HIV, you were presented in form of skeletons. People who had been emaciated
is a word,
looking, wherever, and then isolated, discriminated upon. There's no treatment. There is no hope for them. And then we were not even sure how this disease was being spread. So that fear and stigma was all over. So when it came initially HIV, I am telling you, I think it was even worse than COVID.
It was worse.
It might have been worse than COVID.
It was worse because I read somewhere that the stigma was real. Even people would not even go to get tested at all. No. And many people died in isolation because sometimes you'd find that maybe it was not even HIV, but because of the symptoms that had already been, highlighted. Maybe it's another disease, but you relate that to symptoms of HIV, and then they feared going to hospitals. So we lost a lot of people because of stigma. But when you talk about stigma, it has improved, though there's still some stigma. But I remember, I don't know which year it was, there's this lady called Assunta who came out and said, I'm HIV positive. I think she was the first person to come out publicly and say that she was living with HIV. And then people started to view it differently. From there. So how would you say it has evolved over time in terms of stigma?
There's a lot of, we've made a lot of gains as far as eradicating or reducing stigma in the society, especially for persons living with HIV. And that has, it has involved a lot of awareness from both the relevant government health ministries, from the civil society organizations, from the champions for different areas like TB, HIV champions, and even independent advocacy. It has really played a major role in reducing stigma in the society.
Absolutely.
Also, our education, health education, where you started educating people and saying you cannot get HIV by shaking somebody's hand. You cannot get HIV by sharing a spoon or even borrowing my pen. You cannot get HIV. You cannot get HIV if you're in the same room with somebody who is HIV positive. So it's when people started saying, oh, really? So it's not really that bad. That bad. It's not that infectious unless you actually involved in activities that can compromise you.
And you're leading me now to the next question, which is, what really is HIV? Because I remember in high school studying that HIV is not a disease in itself. So what is it exactly and how is it caused? So that, there are people who don't know still up to date. So I'd like you to just inform us, what is HIV and what causes it?
Well, I will not say that HIV is not a disease, because a disease is anything that makes your body to stop functioning normally. That anything that makes your body defense mechanism not able to defend you. So that is a disease. So for HIV, which is a human immunovirus,
and AIDS
is acquired immune deficiency syndrome. Those ones, they compromise your state, the well-being of a person. They compromise the way your body is conditioned to fight anything that is foreign in your body and that is not wanted. So HIV is a disease.
So HIV is a disease?
It is a disease.
Okay. Then I think I learned differently, because I remember being told it's not a disease in itself, it's just your body being immunocompromised. Now AIDS, I think, now was the disease. Because you've now acquired the lack of immunity.
The lack of immunity.
Yeah, but now, what causes HIV and AIDS?
Well, it's known as a contact disease. Mostly we say sexual contact disease. That is, if you get involved in a relationship or a sexual relationship with somebody who is HIV positive without protection. Protection, when we talk of the use of condoms or mostly is the use of condoms.
Yes.
Is what really protects. Or if you're involved in with multiple sexual partners and you don't know which one of them is HIV positive, then you are at risk of becoming HIV infected yourself. Although we also say there's something a researcher was doing the other day, and they found out that even for women, when you are on your monthly periods and you go along to having sex, you are at a higher risk
of getting infected.
Getting infected if your partner is infected, because that time the abrasion chances are very high.
Yes.
You are delicate. Are you getting me?
Yes.
Then the blood through the tear and wherever, because that time you are soft. So you can very easily be able to get infected.
HIV. Yes.
Get infected.
Okay.
Yeah.
Now, we've talked about stigma. And I want you to, we have about 1.3 million at the moment in Kenya,
Yes.
who are living with HIV, and 73% of those are undergoing treatment. So then that means that there's a percentage with HIV or with who are HIV positive and they're not being treated.
Yeah.
What would you advise someone who's just been diagnosed with HIV?
First of all, I'll tell them not to fear. I'll tell them HIV, the HIV we have now, it is not the HIV that was there in the 80s. Currently, there are life supporting treatment like the ARVs that can be able to prolong your life. You know, before we used to say when you get HIV, it was a death sentence.
It was a death sentence,
HIV
for
is
sure.
no longer a death sentence. So if you suspect or you are symptomatic, it is good to seek treatment and get treatment, and also follow the instructions you are given on treatment, whether it's your ARVs or nutrition therapy. It is always good to follow to the core. Also, don't be malicious to go to infect other people. Yeah, just speak it out.
Bitterness. I think that comes from bitterness, and we've heard a lot of stories on maybe a lady. Mostly it's ladies. There's a lady who has infected the whole university with HIV.
Yes.
And I think mostly, of course, that's not always the case, but mostly it's because of bitterness. Because I was infected, now I want to infect others. And I'd like you to just emphasize on that point. What is the risk of being reckless when you've been infected with HIV?
The risk, first of all, if you are HIV positive and you still go out there and be careless with your sexual behavior, then it means you keep on weakening your own
system.
defense mechanism. You keep on weakening.
So you are harming yourself
You are
more,
harming
thinking
yourself
you are
even
revenging
more.
on others.
Thinking you are revenging on others, much as others will also suffer. But still, you end up being the greatest loser.
Yes.
So the best thing you can do is accept, first of all, it has happened to you. You got you are HIV positive, and then go and seek counseling, psychosocial support, at the same time medication. Because the people that want to infect out there, they are innocent. They didn't infect you. And the situation that led you to being infected, there are very different circumstances from the people whom you will maliciously seduce and maliciously woo, so that you also pass on the virus to them. Yeah.
So you lose more.
Yeah, Ubuntu. I'm a Pan-Africanist.
Yes.
Ubuntu, be human.
Yes.
Have the human conscience. Have the human mind.
I am because you are.
Yes.
You are because I am.
Yes, exactly. Yeah. But that does not mean because you are HIV positive, then somebody else has to be for you to be on the same level. Yeah, let's think humanity, let's think the future, let's think protecting of generations, and let's also focus on where we are talking of having a HIV-free world. Because it is possible.
It is possible.
It is possible.
Now let's talk about the treatment options. You've just been infected, and I know over time the treatment options have really improved.
Yeah.
I know about 10 years ago we had a cocktail of drugs, like 1, 2, 3 tablets that you take at the same time. But now I know that there's one tablet So how did that come about, and how is it helping people, and especially children? You know, children and tablets,
Yes.
it's not easy.
It is not
and we have
easy.
a lot of children living with HIV who have to take the tablets.
Yeah.
Do you have the option of a syrup or something like that? Just talk about the improvement of treatment options over time for HIV in the country.
You see, the most interesting thing, when we talk about disease, we are talking about science.
Yes.
And anything that is scientific, it keeps on evolving or
Absolutely.
changing.
Yes.
Just like we say, there's mutation of the viruses, mutation of the disease, changing form and all that. So even the discovery by the scientists, they encourage more to finding out optional and easier treatment when there is an disease, an emerging disease like HIV at one time was an emerging disease. So there's been a lot of that improvement, as we are saying. And even for children, I want to believe right now we have the preventive, mother-to-child preventive measures.
Yes.
It's not like before when a woman was giving birth, and if she was HIV positive, definitely you knew the child will be HIV positive.
And we'll get there very soon. Yeah.
Okay. So treatment has really improved. You can see we moved from 3 tablets to 1 tablet. And even currently, as we are speaking, there is the new drug that's just about to be rolled out in Kenya next month, the lenacapavir.
Yes.
I call it lenacapavir. I don't know.
Yeah,
I'm
it's
very good in pronouncing. I think it's more French.
Potato.
It's a French.
So it's okay as
It's
long
the
as
same,
you are,
as we
it's
understand what
understandable.
we are
Yes.
talking about.
Yeah.
So it is part of that improvement in delivering of treatment for HIV.
About this lenacapavir, there's a debate going on. I mean, not a debate, but misinformation.
Yeah.
That some people think it's a treatment, not a preventive measure. You know, we have, and I would like you to shed some light on that. We have preventive measures for HIV. For example, when you are raped today and you want to prevent yourself from getting infected, there are some drugs that you will take.
Yes.
Is this the same
The
as lenacapavir, or does lenacapavir also act as antiretroviral drugs for the treatment of HIV?
Lenacapavir, it is like it's
like a prep.
vaccine.
It's not the same as PrEP, prophylaxis. What's it for?
It's for prevention.
Yes,
it's for prevention because it is given like every
months.
6 months.
Yes,
every 6 months. So what does it do? It prepares the body to fight in case of
in case you get infected.
In case you get infected. That's why it's been given to the people who are at high risk of exposure.
Like sex workers.
Yeah, exposure. They're also saying that they want to give to young girls or young people who are just beginning to get into the relationship circles. So it is a preventive
measure,
drug.
not a treatment.
It's not a treatment.
Okay, thank you for clarifying that. Now let's now talk about, now you're on treatment. You were born with it by mistake, or maybe there are many ways that you can acquire HIV.
Yes, of
and
course.
now you want to get into a relationship. How possible is that?
Well, it's happening, and I'm sure we are hearing a lot of success stories.
Yes, I am. In fact, I have a girl, a friend whom I went to school with, and she's open about her HIV status.
Yes.
She was born with it, and she has a child and a partner who are both HIV negative. So how do we make sure that that happens?
There are many ways, because like if you are a positive person and you want to get to the family way, first we encourage you go to visit the clinic and discuss with them of your plans, so that they can be able to guide you on the best way to ensure, and you go with your man or your woman, so that you can be guided together to ensure that how do you get into that relationship without infecting your partner.
Yes.
So that one is a little bit more medical, where you need to be taught about it in a clinic on how to remain positive, get a baby who is HIV negative, and even also
and keep your partner
be able
negative.
to get the seed, conceive without infecting your partner.
Okay.
Yeah.
All right. So there's a lot of progress indeed with HIV. And now, how about breastfeeding? Is there a way that a HIV positive mother can breastfeed their child who is HIV negative?
Currently, I am not very sure, but what I know, there are those who have been extracting the milk.
Expressing the milk?
Yeah, you extract the milk from the mother, and then the baby is fed with the milk without the baby directly suckling on the mother's breast. Yeah, but as you also know that apart from just breastfeeding, when you are giving birth, there's the programs that are enabling women to be able to give birth without infecting the child. Yeah, it's not like before when you were saying, okay, if a parent is infected, definitely the baby will also get infected. We are getting a lot of babies who are being born without the virus.
Okay.
Yeah.
Let's now talk about prevention. About 680,000 people died from HIV-related cases in 2020. I think that's data from the World Health Organization. So this is 2020. There was COVID. Yes. So what would you say caused all those deaths in light of COVID-19 in the country?
I think first the emerging issue, the COVID, when it came, it scared the whole world.
Yes.
Because nobody was sure really what to expect of it. And it was like an accident, the way it came. When an accident occurs, you use whichever tools that are available to save the people.
Yes.
So when COVID came and we were told it was a very infectious disease, which it was, and we were not sure initially whether it was airborne or droplets or how it was transmitted, people were scared of moving from their homes. So most of the patients, those living with HIV, were not able to go and take their monthly or weekly treatment from the medical centers. The lockdowns curtailed the movement too. At the same time, the fear of I'm going to the hospital
Where
to
there's
pick
a
my
crowd.
therapy.
Yes.
To pick my therapy. You don't know from your home to the hospital whether you'll meet the virus on the way.
Absolutely. And I remember there was a scare that there are people who are at a higher risk of contracting COVID, and people with HIV were mentioned, people with cancer and other chronic diseases, diabetes.
Yes, old people.
Older people.
Older.
So it was a scare for many people. And in fact, it's not just for individuals, even governments and institutions actually, even hospitals tended to ignore other diseases and focused on COVID. So if you had other issues, it was not really looked into as much as COVID was.
It is true, but remember, even COVID, because there was no treatment, it was not being looked at all.
Yes.
Because even
it was just isolation.
Even the medics were scared of contracting COVID-19.
Yes.
So they were not willingly dealing with patients the way they should have done, or with the other diseases the way they should have done, because it meant any step near a fellow human being, then that means is a step near COVID-19, and at that time it was a step near your death.
Okay.
Are you getting me? So everybody kept off. And then the HIV positive and even people who had tuberculosis or cancer, the immune system
was weakened already.
Was already weakened, a weakened system. So any encounter with the COVID-19 virus, definitely they knew that will be the end. That will be the end of them. It will take them down. And that's why you saw there was an increase in HIV mortality.
Yes,
at that time.
2020.
Yeah, in 2020.
All right. So before we're about to take a short break, but before we take a break, please advise us in just 30 seconds, in case of another pandemic, how should we handle diseases like HIV and cancer?
We should, first of all, concentrate on the diseases and ensure we don't miss our treatment. Both medical treatment, nutrition therapy, and our normal procedures of containing what is already with us as we wait for further instructions about the emerging new disease.
Pandemic. Okay. Thank you so much, Emily, for coming on the show and for so much insights. We are taking a short break, but don't go away. We'll be right back. Welcome back. If you've just tuned in, this is the Health and Wellness Show. My name is Chabet Birir, and today we are talking about HIV and AIDS and how the stigma and the treatment options have evolved over time. We're also talking about the relationship between HIV, AIDS, cancer, TB, and other opportunistic infections and how to manage that. And with me on set, I have a health advocate, Emily Mukomunene, who is helping us to understand all this from inception. She was here when HIV was first diagnosed in the country. So she's actually the best person to tell us about the evolving of HIV and other opportunistic infections. So now let's talk about those opportunistic infections. And TB is the leading opportunistic infection for HIV and even cancer.
Yeah.
And actually many people who are HIV positive die from TB rather than the HIV itself. Why is that?
You see, HIV with TB is an opportunistic disease.
We say, and first, before you continue, what does it mean to say it is an opportunistic disease? What does that mean?
Okay. Opportunistic means somebody who takes advantage of the available, or something that takes advantage of the available opportunity.
Yes.
Remember, we all have TB, but the TB in us is what we call latent TB or dormant TB. It is the TB infection, but not the disease in us.
Okay.
So anything that compromises your immunity, then it uncovers the TB.
So when you are HIV positive, the dormant TB that you're talking about then takes advantage of the low immunity
of your weakened
state, of your weakened immunity, and then it attacks you
to manifest itself. It's say, I'm also here within you.
Okay.
Yeah. So when immunity is low or compromised, it means you are uncovered. That uncovering now is what makes the TB to shoot up in you. And when it shoots up, if not treated, it very, very, very fast compromises the life of a HIV positive person or even those who are on cancer treatment. But remember, we all get the HIV vaccine at birth. But as time goes by, that vaccine, which is not a treatment, is not effective when you are exposed to TB or when your immunity gets compromised. Because the vaccine we get is not a treatment.
Okay.
But when you get TB, you can be treated. TB is curable. It is treatable. It is curable. So for persons living with HIV, we always encourage them to get to know the symptoms of TB. We always encourage them when they go even for HIV clinics, they get screened for TB. So that in case there's a danger of TB, then with speed, they're treated for TB. Because when you control the TB, then it is very easy for a HIV positive person to happily continue with their HIV medication, the ARVs and the other medication. And the same case applies even to cancer patients, diabetics patients, or patients with any other disease. TB becomes the danger.
Okay.
Because it's an opportunistic disease. It waits. When you are weak, it's when it attacks you.
When you are weak is when it attacks you. Okay. Now, before we talk about the symptoms of TB, let's talk about first the symptoms of HIV and AIDS. In this time and age, what are some of those signs that you will suspect, I think I have HIV?
Mostly we say weight loss, which is not explainable.
Yes.
Sometimes treatment tonsillitis or lymph nodes which keep on swelling, and when you are treating, they are not getting cured. We also say continuous cough, cough that is not responding to medication, which is also the same symptoms even
as
for
TB,
tuberculosis.
yes.
For tuberculosis, and then also we have a fever, night sweats, and excessive sweating. Those are all symptoms of HIV, which also relate
With
to the
TB.
symptoms of TB.
Okay. So what
Yeah.
differentiates TB from HIV? Because I know you can have TB and not HIV.
Yes.
So what are those outstanding symptoms of TB that you'll know this is for sure it's TB?
I will not talk about the outstanding symptoms. I would say it is good when you are symptomatic with any
Any of
symptoms
those
or any signs.
unexplained
that-
weight loss,
Yes.
night sweats, cough that does not go away.
It is good to visit a medical facility
Okay.
so that they can actually tell you either you need to be treated for tuberculosis or you need to be treated for HIV. You need
or
to
both.
be supported for HIV or you need to be supported for both. Because you cannot tell somebody you are coughing continuously and this is not TB. And by the way, incidentally, I met some people, some were friends, and this one of them had chest problems for a very long time. Then, incidentally, the husband discovered a lump on her breast. So when they went for checkup at KNH, she was told she had breast cancer, and she was booked for a surgery to remove the tumor. When they were waiting for the time for the surgery, I bumped onto them. I bumped to the husband and I talked with him. Then he asked me, what are you doing? I told him, this is what I do. And I talked a bit about cancer. And he told me, incidentally, even my wife is scheduled for a surgery. Then we had a discussion. They said, but now she's been coughing. Let me even call her and find out whether she has gone to pick her cough medication. Then I asked him, has she been treated for the cough? He said, no. She's not been treated for cough because this has been going on for over a year or 2 years. So after our discussion, he said, let me actually advise her to come here so that I take her to the hospital to be checked. When they went to the chest clinic, do you know what they found? She was actually not, the problem was not the breast.
Cancer.
It was the lungs.
So it was a cancer misdiagnosis.
It was a cancer. No, it was a cancer
It was
in
a
the
cancer,
lungs.
but not the breast.
No, it was a cancer in the lungs, and TB was just beginning in her. So instead of going for the breast surgery, they rushed her now to arrest the cancer because the original organ was the lungs. Are you getting me? So
Yes.
there's a lot of that. So you cannot really say you are coughing. It is just a cough. You see, she was coughing, but she was going for treatment for cancer. But there was the cancer, and there was also TB, which was beginning in her at the same time. So if you told somebody if you are coughing, it might be HIV or it might be TB, unless somebody is really checked by a professional medical person.
Yes.
Then you cannot tell somebody this is TB. And that's why you see we are failing, because most of the times we treat over the counter. You want to assume, because I'm sneezing, I'm scratching, it is allergy. So you go for antihistamine without knowing, trying to find out what is it that is making my skin itchy. It could be a cancer of the skin. It could be it's called what? The sarcoma. There's that cancer
of the skin.
The cancer of the skin. Are you getting me?
Yes.
But you are thinking it is allergy, or you are thinking it is acne. It might be lack of vitamin D. That's why we seek knowledge and seek also medical advice from experts and professionals.
And the earlier the better.
And the earlier the better. The minute you are symptomatic.
It's better to be told you're not sick than to be told it's too late.
It is
you're
too late.
at stage 4 of cancer.
But it does not mean also that it is raining and I've gone out, I'm not dressed properly, I start sneezing or coughing, and I rush to the hospital. Of course, it is given when it is, or it is very sweating like
when
outside there, and I am walking there and I start sweating, and they say I'm sweating, I'm HIV positive. Are you getting me? So because those are symptoms, you say they are symptoms.
Yes.
Let's also be wise and realistic and find out what would have triggered whatever that
sweating
is, this
or the
sign
coughing.
That they might mistake it for a sign that there is a non-coming disease, or is it my environment at that particular time?
Absolutely.
Yeah.
Now that you've touched on cancer and we are going there just now, but let's talk about how to prevent TB, especially when you're already compromised in terms of immunity, you're infected with HIV and other chronic diseases. How do you prevent TB?
Secret is balanced diet, ensure you have enough fluid intake, avoid overcrowded areas, ensure that whichever environment you are in, there is proper ventilation so that you do not put yourself at the risk of TB. Because even for HIV, if you observe your diet, your liquid intakes, your diet properly, you are taking your vegetables good, you are taking your fruits well, you are resting enough, you are not idle, you are mentally also happy. Are you getting me? All those ones help to build your immunity and to make your body respond better
to treatment and environment,
and also prolong your life and happy moments.
Okay.
Yeah.
Now, how do you? We've talked about now TB and how to prevent TB, cancer, and HIV. What is the relationship between the two?
The relationship is just we say cancer associated, no, HIV associated cancers, or cancer associated HIV, which mostly the one that people talk about mostly is we have the Hodgkin, forgive me about the name. We have the cervical cancer. We have the cervical cancer, which they say is closely related to HIV because of the human papillomavirus. Yeah. So then the symptoms almost seem to be similar. The same. Similar to those of the cervical cancer. So we say if you are HIV positive and you develop human papillomavirus, then you are at a higher risk of developing cervical cancers or cancers of the vagina or even the anal cancers. So for people who are HIV positive, we still encourage them to take extra precaution so that they don't get predisposed to other risk factors like HPV. And when you see you have any sign of HPV, we say you go for treatment of the symptom so that it does not graduate or develop now to put you at the risk of getting cancers. Yeah, and then we talk about the throat cancers or cancers of the mouth. You know, like for the signs of HIV, we find sometimes even you have swelling in the mouth and all that. And if you have that swelling in the mouth and you get exposed to HPV potential environment, then that means there are high chances of you developing the the mouth warts or the lesions that eventually, if not treated, can lead to some types of cancers.
Okay.
Yeah.
And there's also data that shows that about 10% of cancer patients have HIV. How does that come about, and is it possible to prevent acquiring HIV when you're a cancer patient?
Yes, it is very easy. When you are one thing, cancer cannot lead to HIV. No. And the fact that you are on cancer treatment or you have cancer does not mean that you are at risk of HIV. The only risk of HIV is because when you have cancer or you're on treatment, your immunity is low. It's compromised.
Yes.
But you see, having a compromised immunity does not mean you can get HIV. You can get TB, but not HIV.
Okay.
Are you getting me?
Yes.
But now, when you are a cancer patient and you don't protect yourself against HIV, then that means in case you get infected with HIV, then you are at what we'd call double trouble, because you'll be fighting two diseases.
Yes.
That have compromised your immunity and that are also complicated in treatment. And one of them, which has no treatment, it has only life-supporting medication.
Very good insights there. Yes, I'm getting you. Okay. As we finalize, we have about, I think, 8 minutes now. So I want us to talk about, I know time flies, right? So I want us to talk about the diagnostic gaps. You've mentioned the breast lump, and then they found it was a lung cancer. Yeah. You've also mentioned that you have been misdiagnosed of throat cancer before, and you have a friend who was also misdiagnosed. So how do we prevent these diagnostic gaps in the country?
That's why we say we should all acquire knowledge. Remember where we began, eh? Health awareness, the voice of health awareness should never run dry. And the voice of health awareness should never be limited to a particular disease. When we are doing health awareness, let us be broad. Let's expose people so that they know early signs of a disease. Let every person, by the time you are symptomatic, or you are even escorting somebody who is symptomatic or is sick to a medical facility, you already aware of what the potential disease could be. So that if you are coughing, for example, and use the cough because it's a common one,
yes, and
you go and you are told, ebukohoa, toyo kikohozi, and then you say, where any TB? Are you getting me? You can say, no, this happened. We're in there was somebody who was burning trash in an area. It was a very whatever place, and this person is maybe asthmatic or something like that. So they inhaled a lot of smoke. That is where they are coughing or behaving this way. That is before you are put on treatment for actually a disease that you are not suffering from. So let us have knowledge about the diseases.
And use the knowledge wisely.
And use the knowledge wisely. And also, let's eradicate fear. Let's eradicate fear. If you experience abdominal pain, don't take it for granted I might be having cervical cancer. Don't take it for granted that I might be having a UTI or HPV just because you have abdominal pain. Are you getting me? Yeah, when we talk of signs of cervical cancer and we say bleeding when you are not on your periods, sometimes even stress can cause premature monthly flow. Are you getting me?
Yes.
So it does not necessarily mean. So you find a girl who is 18 years or even 15, she just the onset of her monthly period, and after a few days, she spots. Then she'll get into fear. I might be having cervical cancer.
And yet it
and
could
still
be
she's still very young.
Maybe change of environment.
Change of environment.
Or stress.
Or stress, you know, something like that.
Or hormonal imbalance.
Are you getting me?
Yes.
So let's get the correct knowledge. And that is why we are called health advocates or champions. Because we encourage people to seek the knowledge and give them the correct information. In the public facilities, I urge the government and the stakeholders, can we have big screens which are teaching us about prevention? Can we have big screens which are telling us the symptoms of the
danger signs,
the different diseases? Can we have big screens which are telling us the importance of hygiene, drinking water, the importance of nutrition, and what is nutrition, and what is a balanced diet?
And even beyond the screens, I think the Ministry of Health can also collaborate with artists. You know, the easiest way to pass a message is through art.
Yeah.
Musicians, even the media.
Exactly.
And then the message gets faster to the consumers, especially our generation right now, the Gen Zs. If you put put a music or a song out there that talks about diabetes, cancer, TB, HIV, don't you think people will be more informed?
They will be there on their toes dancing to it, and they get the message. Remember, during our time, the 80s, when HIV came, there was a lot of music, and that music actually made people to be cautious. The music, the expressions, even the cartoons. That is how the messages were passed. And that is why we were able to save generations before we got the scientists discovering the ARVs.
Yes.
Are you getting me?
So
we need a lot of that awareness.
Information. Awareness, yes.
And then in schools, we say the best platform to address some of these issues, it is when children are education, when these girls and boys are still experimenting with their bodies, when they're just beginning to discover themselves. Let them have the knowledge so that by the time they are discovering themselves, they are aware of the dangers that are out there. They are aware of the opportunistic diseases, or they are aware that where during our time we used to be told everyone is HIV infected. How do you ensure you remain uninfected? Are you getting me?
Yeah. So wasn't that instilling fear? Wasn't that instilling fear?
No. But you see, no, fear, like in the African society, fear is what brought discipline.
For sure.
At that time. Are you getting me?
Yes.
Fear of COVID-19 is what kept COVID at bay. Is what kept COVID at bay. But also when you are, although I've said don't fear, fearing does not mean you run away from it. Fearing means you confront the truth and use that truth to safeguard yourself and to safeguard the community that you relate with.
So it's to beware, not to fear.
To beware, not fear. Like the book we are holding on the struggle on HIV, TB and COVID-19. We've just started a program where we are saying that every school library should get copies of that book. And then want them to be used as class readers. Why do you want them as class readers?
It's actually a very good book. It talks about COVID-19, HIV and TB and how to prevent.
How to prevent.
I think you should get this book.
How to minimize stigma in the society. How to support those who are on treatment so that they adhere to the treatment and achieve the intended cure. At the same time, it is talking about nutrition. It is also explaining.
You mentioned that you're a natural therapist.
I'm a natural therapist.
So good nutrition is the way to go.
Good nutrition, good hygiene, good exercise, good sitting postures, happy hormones and happy moods. Those are all steps towards disease control, disease control and prevention.
Okay.
Yes. And
thank you so much, Emily. Because of time now, I want you to give us a parting shot. And before that, or while you give a parting shot, I want you to encourage HIV positive patients and people with TB. You know, TB drugs are very hectic to take, 90 days. And also HIV is a lifetime thing for medication. So talk about the importance of adherence to drugs and give us your parting shot.
It is true. Drug adherence is very important. And there's one of my books, The Doctor Must Be Crazy, and I was wrote
That's an interesting one.
Yeah, I wrote that book because I found people did not understand. If the doctor tells you take your medicine 3 times in a day, what do you understand by 3 times in a day?
Asubuhi, lunchtime, jioni.
So asubuhi yako kama inaanza saa 4, alafu lunchtime yako inaanza saa 6. Alafu jioni yako inaanza saa 5 ya usiku. Si umekunywa mara 3? Those are 3 times.
Yes.
But when the doctor says in a day, is focusing on the hours in a day. 3 times in a day means 24 hours in a day divided by 3. Every 8 hours. If you don't take it after every 8 hours, that medication will not help you.
It may not
be effective. It will not work. Because what happens with medication, when you take the first dose, you hit the virus or the disease. So it's sleeping. After 8 hours, it is when it's supposed to be waking up. So if you don't hit it, then that means it will move from the point where you want to hit. So when you are taking it after 9 hours, it means now you will not hit the virus, you will hit yourself. That's why we experience the severe side effects. And if you take that medication 6 hours later, instead of 8 hours, you are targeting to punch me. But remember, I'm still sleeping.
So
the first time you punched me, I was seated. So you punched me right, and I fell down. Then after 6 hours, before now I start waking up, you punch again. So you punch the wall. That is what causes the severe side effects of medication.
Very well explained. Thank you so much, Emily. Because of time, I wish we would have continued. But, you know, you can get more information from 2 of these books and many more that she has written. But because of time, unfortunately, we have to end there. Thank you so much, Emily Mukomunene, for coming on the show. And thank you for the good job that you're doing as a health advocate.
Thank you.
All right, that's it from us. Do not live in fear, but beware. Adhere to drugs if you've been diagnosed with any infection or disease. And remember to stay healthy, because prevention is better than cure. That's it from us. Have a lovely evening. My name is Chabet Birir.